www.healthcmi.com, Acupuncture Continuing Education Online. To learn more about today's podcast, go to healthcmi.com, click on News, and look for the article entitled Acupuncture Beats Drug for Alzheimer's Disease Treatment. And therein you'll see how acupuncture outperformed a major Alzheimer's disease drug treatment protocol. In some ways, it's not saying a lot because why? Even the best drugs for Alzheimer's disease are still unacceptable. In many ways, we can slowly help some cognitive abilities, but is it really adequate to control the disorder? Nobody has that yet, as far as I know, at least at the time of this recording. Now, what's promising and very exciting is that acupuncture outperformed a major drug. And that drug is the primary drug used in Alzheimer's disease treatment. And what's interesting is that even though acupuncture did better, there wasn't a follow-up study yet. And this is what we'd like to see, combining the drug therapy and simultaneously trying acupuncture. Perhaps there's a synergistic effect between the two, and we can get some substantial results that we can hang our hats on and say, now we've got something that's making a big difference in people's lives. Yes, acupuncture outperformed drug therapy, but unfortunately, drug therapy at this stage isn't where it needs to be anyway. So there is some hope here, though, that acupuncture did a good job. It gets into the details, the article, of exactly what assessment scales and tests were used and how people performed in them. But what's more important here is to look at the acupuncture points that were successful and how they got the job done, and then ultimately taking this information and maybe doing a follow-up and trying an integrative model of medicine, combining the drugs and the acupuncture. We might just get somewhere with this. This is a very tough disorder to work with, and there are many forms of dementia. And keep in mind that in many ways, Alzheimer's disease and many forms of dementia are misunderstood. And we only find out with autopsy after someone's passed away that, in fact, something else might have been going on. In fact, we know right now that spirochetes can be in the brain. So they're bacteria, they're spiral-shaped bacteria can be in the brain. Now, this can be from periodontal disease, so things from the mouth traveling through the blood-brain barrier into the brain. And this can be from diseases such as Lyme's disease, Ehrlichia, Babesia, things like this, where these spiral-shaped bacteria cross the blood-brain barrier, and that subacute inflammation and infection may cause plaques in the brain. It may cause dysfunction of the brain. And then we only learn after someone's passed away that it was an infection. So keeping that in mind, that Alzheimer's is still a very broad term, and even dementia a wider term that we use. There are many causes. Of course, there's familial history and genetic inheritance involved in a lot of this as well. So this is a complex web of diagnoses, and that's also broken down in terms of Chinese medicine and the ancient texts in this article. So I invite everyone to take a look and learn about how acupuncture is also part of the fight against Alzheimer's disease. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com.